always causes fear in anybody's mind. But I always tell my male patients that if I were to select a cancer, I probably would go with prostate cancer. Statistics show that 1 in 9 men in the United States will be diagnosed with prostate cancer. What do you know about prostate cancer? Do you know anyone with prostate cancer? Well, today, the topic of our show is prostate cancer. My name is Dr. Cooper Dockery, and welcome to Get Healthy. Get Healthy is a program designed to educate, inspire everyone to use healthy lifestyle habits to live a happier and healthy life. Today on my show, I have a friend, Dr. Asasi, and he's going to be discussing prostate cancer. So don't go away, we'll be right back.
Welcome to Get Healthy with Dr. Cooper. Discover the secrets to amazing health and longevity. Learn how lifestyle medicine, the vaccine for chronic diseases, can profoundly influence mind and body. Learn simple solutions such as healthy nutrition, exercise, strong family bonding, stress management, and spiritual renewal will empower you to live a longer, healthier, and more abundant life. And now, here's Dr. Donna Cooper.
Welcome back to Get Healthy with Dr. Cooper. My name is Dr. Cooper Dockery. I'm board certified in internal medicine, and I've been practicing medicine for the last several years. But I enjoy educating and inspiring people to use healthy lifestyle choices to improve their health. And today in our show, we're discussing prostate cancer. And I have a friend who is going to come up and help us clarify what is prostate cancer for you to see if you have the cancer and what you can do to prevent the cancer. Hey, Dr. Asasi, welcome to Get Healthy.
Hello.
How are you doing?
I'm very well, thank you.
All right.
Very well indeed.
Tell me a little bit about yourself, Doc.
Certainly. My name is Dr. Asase. I'm a urologist. I've been in practice in this area in South Texas for about 20 years. And a urologist is the specialist that you would see as a man with prostate and concerned about prostate cancer.
Doctor, you have an accent. Where are you from?
Everyone has an accent because they all come from somewhere.
I agree. Where are you from?
Well, I was born in Geneva, Switzerland. My parents came from Switzerland and Ghana, and so I know West Africa very well, and I've spent the last 20 years in South Texas.
Very nice. It's a pleasure having you on my show today.
Well, it's my pleasure also, and I certainly appreciate your accent also.
I'm from Jamaica.
Well, that's an important place as far as prostate cancer is concerned. The highest incidence of prostate cancer is in African American men and in men of Jamaican descent.
Oh, that's very sad for me, though.
It could be, but it doesn't mean that it's the end at all. There are good programs to take care of that.
Thank you so much.
You're welcome.
All right, doctor. So, do you see a lot of prostate cancer in your practice here in South Texas?
Most certainly. Prostate cancer is one of the more common conditions that the urologist would be consulted for, and that is a very common one indeed.
Very good, doctor. What are some of the risk factors for cancer? Who are at risk for prostate cancer?
Older men primarily are at risk for prostate cancer. What does that mean? Anybody within the age of 50 and 70 should be screened for prostate cancer. Risk factors include a family history of prostate cancer. For example, if your father had prostate cancer, if your brother had prostate cancer, if more than 2 male relatives in your family had prostate cancer, would be a risk factor. A big risk factor, unfortunately, is also race. We spoke about it a few minutes ago. If you're African American or of African descent, your risk of prostate cancer is about 5 times the rest of the population. So it is very important that that be looked into and that you have that at the top of your screen in terms of checklists for wellness.
Very good, doctor. We're discussing wellness and lifestyle.
Yes.
Are there any modifiable risk factors? Tell me.
Yes, there are some risk factors that you might modify with lifestyle. A big one is obesity. If you can get your weight down, that would help you considerably as far as prostate cancer is concerned, because in general, we do know that people with obesity are very unlikely to seek as much health care as they should have. And so that puts them at some risk as far as that is concerned. Diet is also an issue, because we do know that prostate cancer, for people who have diets high in fish, the rate is very low, as in Japanese men. Elsewhere, it is much higher. So things of that nature.
Right, so diet high in animal products, red meat, processed meats, right?
Those things I would not eat unnecessarily.
Well, you're a very smart doctor. You probably won't, you won't get prostate cancer. All right, very good. Now, what are some of the signs and symptoms? We probably have people watching us,
Yes.
and they're wondering, do I have prostate cancer? Any
I think
signs or
that-
symptoms, Doc?
Sure. I do think that the symptoms of prostate disease overlap with benign enlargement of the prostate and cancerous enlargement of the prostate. They include difficulty urinating, waking up at night to urinate, having a poor urinary stream, feeling incomplete bladder emptying, pain on urination, or bleeding.
That's right. I usually ask my patients if they're older men, say 45 and above,
Yes.
how many times do you get up at night to urinate?
Good. At the age of 45, you shouldn't wake up at all. If you did, that's a little bit of a problem.
Alrighty. So are you listening? If you're 45 and you're getting up to urinate at night, then see your doctor.
Preferably your urologist.
Well, I would say the internist. All right, doctor. So if I have a patient
Yes.
that I'm concerned about,
Yes.
and I send the patient to you for
Yes.
you to assess the patient for prostate cancer, what are some of
Yes.
the diagnostic studies that you would probably perform?
I think the first one is to get a history or a story from the patient. That is to say, what are the problems, how long have you had them, and what are the issues that trouble you? Level of bother is important. Then we would do an examination. An examination of the prostate we will come to shortly and show you what it involves
That's
and where the prostate is, because we're talking about prostate cancer and many people don't possibly know what is a prostate, where is my prostate, why do I have a prostate, and why is it that it gives me problems.
You
for
know
example.
what? I think we should go right over there,
Oh,
look at the
good.
anatomy, and
Yes.
discuss that. Come along with me,
Sure,
doctor.
sure.
All right. So we're going to get some pictures right now. You can come right here,
Yes,
doctor.
of course.
And then we're going to go to our first slide. Let's see if we can look at the anatomy.
On the first slide here, we have what's called a sagittal or a side view of a mannequin, if you will. And what it shows is here is your bladder. Below your bladder is a gland called the prostate. The most important thing to note is that there is a small tube from your bladder that comes out through the penis for one to urinate. That tube courses through the middle of the prostate. Anything happening in the prostate that will constrict this tube results in symptoms of not being able to urinate easily, having to strain to urinate, and finding that when you empty your bladder, you are incompletely empty. Those are the symptoms of prostate disease, and it is because of the location of the prostate. It is accessible, as one can see here, through the rectum. So generally, in answer to Dr. Cooper's question, how do you evaluate for the prostate? You do so by having a digital rectal examination where your doctor or your urologist or internist would examine your prostate in this fashion by using a gloved, lubricated finger to determine the size and the configuration of your prostate to determine if you might have a problem like prostate cancer developing. That's where we evaluate the prostate.
Thank you so much, doctor. At what age would you suggest
Yes.
that we start at least screening for prostate cancer?
If you have no family history of prostate cancer known to you, the age of 50 is satisfactory and recommended by the American Urological Association, and that is basically subscribed by all other professional organizations in the area of prostate cancer. Now, if you do have a family history of prostate cancer, that is to say, father, uncle, brother, cousin, have prostate cancer, you need to start screening at the age of 40. So if a man is 70 years old and has prostate cancer and his son is 40, you need to start screening at that time.
Very good. Doctor, what are some of the screening techniques that you recommend?
Yes.
I mean, I do certain things in my office,
Sure.
but tell me, you're the expert.
I think that what you do in your office has been driven primarily by what the experts have told you in the past and updated, refined in a refined fashion on a yearly basis.
Right.
You do a digital rectal examination if you're comfortable with that, and that's really a very necessary piece of it. And the other is that you do a blood test called prostate-specific antigen. This is a blood test that is very important as it signals whether there is something going wrong with your prostate or not, and then compels you then to have it evaluated by a specialist for prostate cancer.
Very good. So I probably do that once a year.
Yes.
Is that good enough?
That is perfectly satisfactory.
All right, so let's go.
Especially if you have had results that have been normal the prior year, what have you, it is perfectly satisfactory to do it once a year.
Right, and then we look at the levels, and if there's an increase in the level of the PSA, then at that time I need to take action.
And the action would be to send the patient or the gentleman to a urologist.
Like yourself.
Like myself, to be certain that this elevation is not because of prostate cancer that you could treat because it was early.
That's right, I love that. Let's look at slide number 2. What do we have there? All right, doctor, let's see what we have here.
What we have here is a rendition of the anatomy of a normal person with a normal sized prostate, where the channel that you're urinating out of is wide and open. Therefore, your symptoms when you urinate are minimal to none. You don't wake up at night, you don't dribble, you don't have to strain to urinate, and you don't have pain with urination. On the other side, closer to Dr. Cooper, you have the same rendition, but you now see that there is a growth of a cancer here which appears somewhat advanced, and its effect has been to compress the channel through which you would normally urinate. It stands to reason when you see this that evidently there is a blockage, and you will start experiencing the consequences of that blockage with diminished force of stream, need to strain to urinate, incomplete bladder emptying, and feeling that you're full after urination.
That's right. You know, were you a teacher in your past life?
No, I didn't have a past life.
That's a joke, doctor. But you sound like a professor. You're doing very well. Thank you.
No, thank you, Dr. Cooper. A pleasure to be here.
Let's go to the next slide. Let's see what we have there. I think this is just more or less a repetition.
Yes, this is basically to reinforce what it is that we've just talked about. This is a healthy, normal prostate. This is one with enlarged prostate. The prostate is here. The opening is not narrowed. Here, it is a larger prostate. It has growths in it. These growths have not yet began to compress the pathway, but they shall left untreated. Our goal is to find them when they are this size, when they are eminently treatable.
That's right. And as I mentioned when we opened the show, that if I were a man and I was asked to select a cancer, I probably would select prostate cancer. Why is this so, doctor?
I think that, first of all, this is not to say that illness is good.
No, of course
not. But if you are to end up with it, would you prefer to have a prostate cancer versus, say, a pancreatic cancer or some other cancer of that nature? The reason to answer her question is that it is eminently treatable, it is generally slow growing,
That's right.
and we are getting very much success with treatment of prostate cancer because we now find it very early with tests like you do, PSA and rectal examination.
Thank you so much.
You're most welcome.
Doctor, is there anything you want to say before we move on to probably lifestyle? Because I'm a lifestyle doctor and I want to emphasize modifiable risk factor. Any last minute word to the audience? To the audience, I would say that watching a show like this is excellent as far as your lifestyle is concerned. It brings information from multiple specialties that are important. And in my opinion, I think that certainly watching a show like this is a wonderful thing and a great service as far as I can tell. Well, I just want to let you know that prostate cancer, they're a modifiable risk factor. As the urologist said earlier on, obesity is a risk factor that you have control over. The diet, choosing healthier diet, decreasing animal products, exercise, all these are important to maintaining good health. Dr. Sassi, has been a pleasure having you. Thank you so much. Great deal. Thank you. Good evening. Don't go away, we'll be right back.
Cooper Wellness Center now offers a wide variety of vitamins and nutritional supplements. Omega-3 protection for the brain. Coenzyme Q for your health. Turmeric, the wonder supplement, great for joint pain. Vitamin D3 to promote healthy bones, plus many more multivitamins for women and men. Find these quality non-GMO supplements at great prices online or at Cooper Wellness Center. Live healthy, live smart.
and welcome. If you like to eat something sweet, then I'm going to show you how you can prepare that without feeling guilty. You know, the emphasis of this show is to educate you on how to live a healthier lifestyle using healthy nutrition. But sometimes we think healthy is only fruits and vegetables, nuts and seeds. But actually, you can have a healthy dessert. And so many times, those people who are whole grain, who tend to eat healthily, cannot find a healthy cake. So on the show today, I will be making a vegan cake. I'm going to give you a basic recipe that you can tweak at home using different fruits and spices. So we're doing vegan cake, and it's going to be a fruit cake with lemon. So we're going to start first of all with the sugar. So what type of sugar I'm going to be using? I want you to use cane sugar. It's less processed, it's less sweet. So if you're diabetic, your sugar will not rise that rapidly. So I'm going to put the sugar in. Let's go. So it's going to be 1 cup of sugar. This is half a cup, and this is another half a cup, and use cane sugar. Now for the milk, I won't be using any oil because I want to make sure the cake is as healthy as possible. So I'm going to be using coconut milk, and using 1 tin of coconut milk. So let's get the milk out. You know, I like to make this cake for the restaurant, the Food Med Vegan Restaurant. We do different types of healthy cake, and this is one of those. So if you're oilless, if you're a whole food, plant-based person, but you don't use oil, then listen up, because this is a great recipe you can do at home. Now I am going to be adding my fruit. This is actually apple, and I have grated my apple. This is it. So I used an apple about a moderate size, and I have grated the apple right here. So I have this left over. So the apple is going to be added, and the apple is good to help the cake to rise. So it's going to be half a cup of a grated apple. I'm not using applesauce, but actually grated apple. So it's there, half a cup. And then I am going to be adding my lemon juice. The lemon juice is fantastic, so the cake will rise. I'm using about 1/3 of a cup of lemon juice, fresh lemon juice. So I have it here. And then I zested this lemon here. So if you have a zester, you can just zest it just like this. If you don't, just use a grater and just grate it and get the zest off. Just add it in, all right? So this is my zest, a whole lemon that is zested. It's right here. It's going to give the flavor. Get some vitamin C because you have the the lemon juice right there. From there, I'm going to be adding various fruits. So I'm using raisin. So the raisin is here. I'm using half a cup, and these are the small raisin or currants. And of course, you could add any fruit. So I'm adding right now my cherries that are chopped. Now I also like to use vegetables in my cake. Remember that this is an emphasis on eating healthy. So here I have, what is this? This is beet. I'm going to put some beet to this. You know, I also put green leafy vegetables in my cake. That is fantastic. So I'm going to put some beet in the cake. All right. So you can put half a cup of grated beet. All right. So let me put some right here. And remember, you can put any vegetables or any fruits. All right. So it's about half a cup of beet, grated. I'm going to mix this around some. Make sure the sugar gets melted out. This is really delicious. Just try this at home, and I mean, it is fantastic. Now I'm going to add my flour. I am using 1 cup of regular flour and another cup of whole wheat flour. So if you can see here, it's really brown. All right, because we're going healthy. We need fiber in everything we consume to prevent diseases. This is going to be amazing. Now, I'm going to be using 4 teaspoons of baking powder, all right? And then 1.5 teaspoon of baking soda. Remember that we have no egg, no oil in here. And I am going to be using 1/2 teaspoon of salt. So here's the salt. To that, I'm adding some spices. I'm adding cinnamon, and I'm adding nutmeg. You can also use mixed spice. And I am missing my vanilla. Where's my vanilla? All right, so here it is. It's white vanilla. It's 1 teaspoon of vanilla. Alrighty. So we're going to mix this all together. Now, if you have a mixer, just use the mixer. If you want to be old-fashioned like myself, you're going to mix this all up. You're going to put it in your baking sheet, your baking tin, that you will have to grease. Or you could use a non-grease tin. And then you're going to bake that for 6 to 7 minutes of 350. This is good. And if you make it at home, send me a message. Let me know how it comes out. All right. So let's get everything out of here. You can have this with some delicious vegan ice cream. And by the way, you can find most of these recipes in my books. I didn't even mention that. So here we're ready to go. I'm going to put this in for 6 to 7 minutes, 350 degrees Fahrenheit. Let's see what happened. Now you have to preheat your oven. Now, here is the final product. Here we go. Fantastic and delicious. Very sorry you can't taste it, but after the show, the cameramen are going to be tasting it. This is really, really good. I want you to take a look at this fantastic looking cake. Here we go. So this has beet, it has orange, it has cherries, and raisin. So for more recipe, go to my website, drdonnacooper.com.
Your doctor delivered some bad news, but the good news is Dr. Cooper's book, Get Healthy for Life, can save your life. Order today at drdonnacooper.com or call 1-844-343-8935.
Welcome to Get Healthy with Dr. Cooper. Do you have diabetes and want to get rid of it, or high blood pressure and want to improve your blood pressure? Then we have something special for you. Active living 30 minutes a day or 60 minutes a day will cure your diseases. Ramsey, what do you have for us today?
Hello, Dr. Cooper. You're right. I like that explanation. What we have today is just going to be an exercise with resistant bands, going to focus on the lower body. We have our beautiful ladies here just to show us. What we're going to mainly focus on is just going to be 5 exercises. We're really going to focus on the front squat right here. We're going to use a little bit more abdominal muscle to sustain us. Here, we're going to have the girls bring the resistant bands all the way up, drop all the way down. Let's go. We're going to get a good 5 in. Here, we really want to focus on bringing that butt as low as possible and keeping that back straight. Keep that back straight. Don't try to lean too much, especially with this exercise. We do have the instance to lean a little bit more, but just try to sustain yourself and go as low as possible. For some of us, we can't go that low, so again, push yourself to go as low as possible. We're gonna go at least 15 to 20, 4 sets. 4 sets total, 15 to 20. Now the next one, we're gonna do a straight leg deadlift. Straight leg deadlift with resistant bands. We're not using any weight in this. All we're doing is going down as low as possible, keeping the legs straight, coming up. Not everybody has the same flexibility, so try to push yourself as much as you can. It's not easy, but try your best. Again, we're gonna go 15 to 20, and that's our segment for today. Dr. Cooper, thank you for having me. This was quite an experience.
Thank you, Ramsey. Thank you. I noticed they need a lot of balance for this exercise,
yes,
right?
Yes.
So,
a lot of core.
There you go. You out there, if you have difficulty balancing, just go slow. And remember, if you want to live a long and healthy life, you must move. Exercise is important for good health. We'll be right back. Don't go away. welcome back. If you're just joining us, you're watching Get Healthy with Dr. Cooper. And our theme today, the topic today is prostate cancer. And you are now in the segment where you can be a part of this segment. If you have questions, send them to me via my social media platform or my website. But today I know I have Adrienne taking questions from the community. So let's go to Adrienne's first question.
Hi, Dr. Cooper. Today I'm here with,
Cesar Lozano.
and today he has a very important question.
What can I do to prevent the prostate cancer?
All right, so I love that question. He wants to learn how to prevent prostate cancer. Well, let's start from the beginning. There are certain factors that are modifiable. Eating a healthy diet is important. Staying away from the processed food, the fats, staying away from tobacco smoking. Make sure that you are incorporating a lot of green leafy vegetables in your diet, nuts and seeds and fruits. Exercise is important because exercise can boost your immune system and place you at a state where you can fight the cancer. And also, prevention is important. If you are 50 years old and you're having problems with urination, weak stream, make sure you see your doctor to be investigated. And keep following me and you'll learn much more how to prevent cancer. Let's see if we have another question from Adrienne.
Hi, Dr. Cooper. Today I'm here with,
Griselda.
and she has a very important question for you.
Yes, Dr. Cooper. At what age should my husband check himself for prostate cancer?
Very good. Well, Griselda, you appear very young, so I think your husband might be young. However, if a man has a family history of prostate cancer, then he needs to get himself checked from age 40. If there's no family history of prostate cancer, then starting at age 50 is important. And you know what? That cancer is a disease that is preventable. I say preventable, but you must take care of your health. You must embrace a healthy lifestyle so that cancer cells will have difficulty transforming and growing in your blood. If you want more information, then call the number on your screen. I can be your health coach. I have online courses, I have books, my books are here that you can use to stay healthy. And most importantly, God wants you to be healthy. In 3 John 1 verse 2, he said, "Beloved, I wish above all that you prosper and in good health, even as your soul prospereth." So call now and keep following me. I'll see you soon. May God bless you.
This broadcast was sponsored by Cooper Wellness Center and Faithful Path International Ministries. For more information on how to become a patient or a sponsor, please contact us at 1-844-343-8935 or visit our website at drdonnacooper.com.